Hi, Bill. Thank you so much for joining us today on Vitik America.
It's a pleasure to be here. Thank you for the opportunity.
Of course. How do you live your life in the coronavirus pandemic? Do you stay at home? Do you travel? Do you or would you go to restaurants or concerts?
I'm self-isolated at my apartment in Manhattan. Fortunately, it's very pleasant. I'm right across from the Metropolitan Museum on Fifth Avenue, and that gives me an opportunity to have an early morning bike ride. For example, this morning at 5:30, I took my bike around the park. There's almost no one there. I feel quite comfortable. Um, I wear a mask when I go out. I wear gloves when I go out. And I'm careful to stay a good distance away from people. I don't go to restaurants, and I try to avoid any place where there's a high density of people,
Well,
or virtually most people at all. I try to avoid.
I know you're a
I don't
Renaissance
travel.
man and you know how to live and you've always contributed to the arts. And so it's probably very hard that at the moment everything is on standstill, on hold. Um, But what would you say? Should people wear masks in public in general, the general population, even if only simple surgical masks or disposable gloves, goggles, face shields? Because it's a big discussion here in Germany amongst experts.
I think it's only responsible to wear a surgical type face mask when you are interacting with anybody outside your immediate self-isolating group. The purpose is to prevent droplets from exiting your mouth and nose as you speak, as you breathe. We know that's an efficient way to transmit the virus. If people are careful about how to wash their hands, I don't think they need to wear gloves all the time, but it's very, very difficult not to touch your face. And if you're out and you touch other objects and you touch your face, you run a risk of infection. Let me say all of this is predicated on the notion that there is a substantial circulation of virus in the local population. So in Manhattan, there are more than 2,000 people every day being diagnosed. A number of people are dying, about 200 a day or more are dying in our city. And even though there are efforts to try to control it, it's been maintained at a pretty steady rate for the last month. Uh, a consideration, for example, for not wearing a mask is that we're exactly the same number of people who are getting infected and dying as we were a month ago. And that doesn't give you great confidence that people you are interacting with aren't infected. My assumption is everybody who I don't know and is in self-quarantine with me might be infected. And their assumption should be, I'm infected. And in that circumstance, the only reasonable thing to do is to wear a mask to prevent you from infecting them in the hope that they will wear a mask so they won't have a high probability of infecting you.
I see it exactly the same way, and I'm just a layperson. With regard to conspiracy theories, do you have any anecdotal evidence? Do you see it with your own eyes in Manhattan? What's going on? Are the media, the TV pictures of corpses in, body bags, is that exaggerated, or is that something that you actually also witness happening?
It's minimized. For example, on 76th Street, there was a temporary morgue, and there were a friend of mine went in with a camera and counted 40, actually walked over 40 body bags on the street.
That
It
is
is not
shocking.
exaggerated.
That's shocking.
It's underrepresented. And that's pretty shocking between Park and Lexington Avenue in Upper East Side Manhattan to have body bags on the street is not a happy image. And I don't think you see that image.
Right. I'm in Corona exile in Germany. That's actually what I had expected. Having followed the Chinese media and international media in January already, it's an enigma to me why all the other countries' policymakers thought that it couldn't hit us or wouldn't hit us the same way. But let me ask you, lockdown versus exit, lives versus profit, the vulnerable versus the healthy. We hear basically the same discussion everywhere, be it in the US, in Germany, or the UK. How should people think about this apparent dilemma, if it's any, and how should policymakers approach it?
Sandra, problem is we have examples that show that it's not a dilemma that it's made out to be in the West. The way the East Asian countries have handled it, which is very, very strict lockdown, allowed them, unfortunately, they climbed up a very sharp peak of infection, but by taking restrictive measures, that is, identifying people who are infected, thorough contact tracing, and mandatory self-isolation for all those exposed, regardless of whether they've been tested or not, mandatory isolation in a controlled facility for all those exposed, allowed those countries to eliminate or dramatically reduce the infection to the point the economies are now reopening. That has not happened in Western countries. We have asked people to voluntarily self-isolate. But what we do is instead of climbing up a mountain and coming right back down the other side, as they've done in most East Asian countries, we have climbed up the mountain only to find it's a very long plateau and the downslope is barely visible, if at all. And that's why here in New York City, the infection rate today is the same as it was, or let me say that the reported number of infections is the same as it was a month ago or 6 weeks ago. We have reached a plateau, but we're not climbing down rapidly from that plateau, nor is the U.S., nor is the world. In fact, if you look at the world as a whole, things are not looking up.
So what would you...
There's not a contrast. There is a contrast by how people behave in the early days of the infection, whether they self-isolate or whether they are required to be isolated. And that's a huge difference in the way you reduce the infection. You know, without medicines, without vaccines, you can eliminate the infection. There's not been another infection in Beijing for over a month now, not one. Is that true for any other city in the world? Barely not. Is that because the Chinese are resistant to the virus? No. It's because they've taken much more stringent control measures. Humans can do it. We could do it in the U.S. We could do it in Europe, but we don't.
So what would you say to people who favor the herd immunity approach and who say, look to Sweden, and they argue that only the old...
There is no such thing as herd immunity for... Sandra, there is no such thing as herd immunity for coronaviruses. Coronaviruses have an ecological niche where they trick your immune system so they can come back every year. We know that there have been 4 coronaviruses in circulation in the general population that have been there for over 50 years. The same 4 strains keep coming back and back. You get infected, you recover from your cold, and you get the same cold from the same virus the next year. That is what these viruses do. So the notion that you're going to have herd immunity is just not true. It's not, there's no evidence, no basis in medical or scientific literature that would suggest that is true. Quite the contrary.
Mm-hmm. Okay, and looking at treatments potentially, President Trump has just announced that he's on hydroxychloroquine, and he's long been pumping this as a panacea.
That might be fake too. That might be fake news too. Who knows if he is or isn't? He might just be stirring the pot.
I agree, but he's recommending it to the population. What do you think of that?
Well, that is dangerous. That is extremely dangerous. And we know that hydroxychloroquine for people with heart disease is lethal. It can be very dangerous. First of all, it is now enough studies have been done to show that hydroxychloroquine is not effective either in preventing or in treating the disease, and moreover, is toxic to people with underlying heart conditions and can kill them. So it is unwise in the extreme and unfortunate.
And I guess you would also not recommend injecting Clorox and sunlight.
It depends who. Depends whether it's a friend or foe.
Okay. And there's been a new syndrome in children and young adults that has recently surfaced in greater numbers, which seems to resemble Kawasaki. What should parents know? And do you think it's advisable for schools to open before we know more?
First of all, this disease in young and old seems to have a reasonable fraction of people who are infected, are ill, and then seemingly recover, have long-term consequences. Those consequences can include heart disease, lung disease, kidney disease, gastrointestinal functions, and even neurological disease. So it's not just children. There are now there are enough patients who have survived and people have on observation. Perhaps 10% or more of adults have very serious long-term consequences. I have several friends who have had very serious effects. Some have been hospitalized, and 6 weeks later, it appears to come right back, perhaps in different forms. That's pretty much what's happening to children. They may get infected. It may look like it's not a big deal, but 6 weeks later, 4 weeks later, they may come down with a life-threatening illness. And I have friends who have children who collapsed and almost died if it hadn't been taken immediately to a hospital where you have teams of 10 or more people trying to resuscitate them. That is a very long-term consequence, and it's a significant fraction of children. And I think every parent should be worried. That syndrome now has a new name. It's called multi-system inflammatory syndrome, C for children.
And is that what you just said? People get sick and then they seem to get better and then they get sick again. There's just been in the news that this warship, military ship, sailors have become sick again. Is that because testing has been faulty, or is that because there may not be immunity in all people who once suffered from it?
First of all, it's not clear if there's immunity in any people who suffer from it. Going back to the 1970s, there were clear experiments where people were shown to be reinfectable by a virus they had previously cleared. Now, it may not happen right away, but it happens over a relatively short period of time. That is one of the ways these viruses survive. The other way they survive is they survive in our mucosal membrane, particularly the nasal membrane. And immunity in mucosa is very different from immunity in other parts of the body. You need a special kind of antibody called IgA. And evidently that isn't frequently made in people with infected by coronaviruses.
So maybe expect a vaccine then, if ever?
The question about a vaccine is currently open. I'm distressed by the seeming optimism based on insufficient and invisible data. It appears that there's a new syndrome related to COVID, which I call scientific and medical publication by press release. It happened with the Oxford vaccine. It happened with remdesivir. It happened with hydroxychloroquine. And now it's happened with the Moderna vaccine. Who can tell what happens if you can't see the data? It's very much like a company saying, oh, we made a lot of money this year, but nobody ever allowed to see their books. Or if they do see the books, it's far too late to make an investment decision. Would you do that, Sandra? I don't think many people would. Would many people take the CEO's word for it? The company has made money.
So how should we adjust our expectations? There may be a vaccine, but it would take a long time. It could be 50-50. It's entirely uncertain. How should businesses plan?
That's a very good question, Sandra. And I think businesses should plan for a prolonged period where you have to treat everybody in your employ as a potential source of infection and everybody in your employ as potentially infected. That means maintaining distance, maintaining masks, maintaining strong health programs to help those of your employees who do get sick. It may be infrequent, but something that people should keep in mind is with an infection like this, it took one person to infect the world.
So then, because everybody is so focused on a vaccine and Donald Trump is trying to kind of stoke the fire with his competitive and protectionist approach, do you think if there is any chance that we will develop a vaccine, will that be like a mutual global effort, or do you think the US has a chance to develop, or any country for that matter, to developing a vaccine all on its own? Should it be a competitive approach?
There's nothing wrong with competition. Competition is healthy. It makes people work more quickly. What I would like to see is openness. If people are going to claim they have results, they have to be transparent. I think there can be a vaccine. I'm not saying there can be. There could be a vaccine, but we're not sure.
So then, another question with regard to how a vaccine works. Say the Americans were to find a vaccine first, and then all Americans were to get vaccinated, but none of the rest of the world. Does that make Americans immune, or does a certain percentage of the population of a country or the world has to be vaccinated for this to work?
I think what you've described is an unlikely scenario. First of all, in my opinion, the leader of the vaccine is a Chinese company. And the Chinese have many different approaches that are equivalent to our approaches. They have the knowledge, they have the expertise, but they don't have the patience. So they'll probably be testing their vaccines in Nigeria and maybe in Germany. I doubt they'll test them in the United States. But there's no guarantee that the United States is by any means a leader. The only really published data of a vaccine that looks good to me is a Chinese vaccine. So I don't think that's going to be a relevant issue. The issue is, as it has always been, is will poorer populations within a country or in different countries have the same access to the vaccine? And the answer to that question has always been no. Why should it be different now? Especially when the organizations responsible for that are coming under such stress, such as the World Health Organization. Now, over time, as with smallpox and almost for polio, the world has gotten together and decided those are such threats that they're going to do their best to vaccinate everybody in the world. There are issues with that have arisen, both political and philosophical. Philosophical in the sense that some people believe you shouldn't be vaccinated, that it's God's will that you die. And that's a very hard thing to counter with any kind of scientific argument because it's not based in the realm where science or medicine can approach it. It's based in a belief, not a factual realm. And so those are the kind of problems you're going to run into if we have a vaccine. I would say at this point, the question is not when we'll have an effective vaccine. It is an open question of whether we will have a vaccine. And if we do, will it do any more than give you temporary protection? You know, we have managed to control HIV/AIDS without a vaccine. In 1986, I predicted we wouldn't have a vaccine shortly. It's been a long time since 1986, and we still don't have a vaccine. But in countries where you have a good health system, you can prevent that from becoming a rampant infection in the population. But even with those measures, in some places like Durban, South Africa, you find pockets of high infection rate. And when I mean high, 3 years ago when I visited Durban, 70% of young women between 15 and 25 were infected with HIV. That's what I mean by high. So if you respond properly, you can control things. If you don't, you can't. And that's a lesson we're learning here in the U.S. as we watch the infection spread, and we've reached this plateau that we're not climbing down of very quickly. It isn't that the knowledge of what to do doesn't exist. It's that we're not using it.
But just from my understanding, just once more, for a vaccine to work, it's not a precondition that a certain percentage of the population is vaccinated. If only, say, the rich, Donald Trump and his friends get vaccinated and all the rest of us don't and we die, they are still safe. They cannot get it, even if it's only temporary for the time being. Just procedurally how a vaccine works. Is that correct?
That's a more likely possibility for that. are drugs that prevent people from being infected. For example, I think it is highly likely that we will have monoclonal antibodies that a combination, a cocktail, 2, 3, 4 monoclonal antibodies, which can be given by injection every 4 months, that would be the equivalent of a vaccine. That will only work in places where you have a highly developed medical system and you have people who can afford it. You have a country that can afford it. It's a very expensive proposition. In that circumstance, you may have people who are protected and a vast group of people who are unprotected. That will happen. This is already happening in a way. If you look around the world at who is actually being killed by this virus, is by and large those underserved populations. You look in India today, massive epidemic on the rise, and it's mostly in the slums. You look in the United States, the underrepresented minorities, blacks, Hispanics, and others, just poor whites, have something like 4 or 5 times the rate of infection and death that occurs in other communities. So we're already segregating populations on the basis of socioeconomic status. And let me say that isn't new. For the last 10 years, people have been focusing on what are called the social determinants of health. How important is a good health system in a sea of dysfunction, social dysfunction? And what you find, let's just take Chicago, for example. What you find is 4 subway stops away from some of the best hospitals in the world, you have 20 years shorter lifespan. It isn't that you can't take a subway 4 stops. It's that your total environment mandates or militates against your good health. And so this virus feeds into that social inequity. And it's social, cultural, and global inequity that we know and have known existed forever. And this virus is no different from that.
Mm-hmm. And looking ahead, assuming that we will get a grip on COVID-19 in the coming years, what's the likelihood of another similarly devastating virus hitting us on its heels?
100%.
100%.
100%. The question is not if in this case, because it will happen, but when it will happen. Many of us have been predicting this. I was predicting a respiratory virus that would cause a devastating pandemic since 1985. And we've had several, but this is the worst. It could be a flu virus. It will certainly be more coronavirus. There's a vast world of coronaviruses in many, many animals, mostly bats, but not only bats. Every mammal you can think of. The last epidemic of a coronavirus that was lethal, which is still going on, by the way, didn't come from China. It originated, we think, from a tomb bat in Egypt that infected a camel that went to the Middle East. And those camels are still infected and still infecting people who themselves then infect other people. And that's still going on. It's happening, as we speak. That's just one of the many. The cold viruses that go around every year, one of them they think came from cattle. They come from animals you may never even have heard of. Most people aren't cozy with pangolin, and this virus might have picked up a little piece of a pangolin coronavirus. It's a big world out there of viruses. The way to think about the world of viruses is as vast array of intelligent machines randomly trying to crack the code of human immunity. That's what's going on. Viruses change all the time. They throw up random mutations, just like artificial intelligence does, and they try to solve the problem. The problem is how to infect us, how to get around, and we're making it easy. There are a lot of us. We travel like crazy. We live tightly together. We have vast social inequity where some people are jammed cheek by jowl and have to go to work because they starve if they don't. And, by the way, it cracks our political code. It cracked the U.S. code a heck of a lot better than it cracked the Chinese code. But that's what these things do. And there are millions. Those experiments, there are trillions happening every day. in the natural world. And to ignore that and not to be prepared for the inevitable. Anybody who thinks that this epidemic could not have been foreseen should see the movie Contagion. Mm-hmm. It predicts almost every single thing that's happened. Very accurate, down to the minute details of what's going on. The only thing it misses is political denial.
Yeah, that's a great way to explain it, if slightly discouraging. But looking at the economy, because not only are you a legendary scientist, but also an extraordinarily successful businessman and investor, how long do you think it will take the U.S. economy to recover?
You know, I've been talking to top economists. One of the things I'm doing this is interviewing leaders, thought leaders from many, many different walks of life. And it's going to take a very long time. First of all, the whole world is going to have an enormous debt crisis. Whether there's a crisis or not, we're going to have enormous debt. It'll blow up the U.S. debt 3 or 4-fold. So we're going to have a 10 trillion plus debt. And other countries will have correspondingly enormous debt. That is going to be, okay, that itself is a big problem because it means interest rates have to stay really low. It means inflation is probably in the cards. And it means that investment is going to be complex in that environment. And opportunities for young people for new jobs are going to be complicated. That's just a fundamental basic of what happens when you acquire such massive government debt. Second thing is, if you think we're going to get back to consumer behavior like we did before, very unlikely. Very unlikely that consumers are going to go back and be happy to do the kind of spending they did before, congregate as they did before, because unless this virus is gone, and there's no quick way to see that it's going to be gone, people aren't going to be comfortable being in big groups. We build deep suspicion. I walk down the street in New York, and if I don't leave the sidewalk, somebody else leaves the sidewalk. Fortunately, there aren't too many cars, so we're not getting mowed down. But that's the way people are behaving. Not everybody. You know, a lot of young people are out on 2nd Avenue getting boozed up because the sidewalk bars are open and not paying attention to social distancing. But that just means the virus is very happy under that circumstance. So it's going to be a long, long time, Sandra. I foresee at least 10 years and probably more of very serious economic dislocation.
Well, some industries presumably will benefit from this pandemic. Which ones do you think that will be?
You know, that's a question for very clever investors, both the people who go long and the people who go short, and everybody in between.
And in the healthcare space?
Going to be a very, yeah. You know, healthcare is suffering horribly. If you want to look at an industry, this is something people haven't really written about. About 20% or more of actual GDP, whether it's what you spend, et cetera, but the actual GDP is healthcare. And people just aren't going for healthcare. I know hospital systems that are losing $500 million a month. $500 million a month because patients aren't coming. They don't want to. Nobody wants to see a dentist. Think about it, Sandra. You think of the dentist leaning over you while there's stuff splattering out of your mouth, and he's just done that to 4 other patients before you. You want to go there? Mm-hmm. You know, even for a routine operation, we're seeing a lot of death for people who aren't going to get cared for diabetes, heart disease, neurological function. We're seeing a wave of suicides of people who are despaired because they don't have a job. They don't know what to do with their life anymore, and they're under tremendous stress. If you look at excess death over those directly attributable to COVID, it's almost twofold. So the healthcare sector, not only is it doing well, it can sink the economy. If you have 20% of the economy, and maybe even more, the only source of job growth in any industrialized economy is healthcare, steady job growth. And that is suffering and sputtering. What's going to happen to that economy? It had been what I call the ballast of the ship of the economy, this tremendous growth in healthcare GDP. Every country has experienced it. I once talked to the Giulio Tremonti, who was the finance minister and deputy prime minister of Italy. I said, Giulio, you can do much more. I can show you how to be much more efficient in healthcare. He said, yeah, I believe it. You've shown me that it will work, but I can't do it in Italy. It's the only job growth we have. I started getting more efficient in healthcare services, and I'm out of a job. And the Italian government will change. You can't do that. It's the only jobs we have. Well, guess what? Those jobs are under very, very serious stress right now.
Will our world ever revert to the previous normal, or do you think COVID-19 will substantially change our world? And if so, how?
It's changed our world, but first of all, what's normal? I've lived long enough to see many normals. So I'm not sure what is normal. I remember when the Cold War was normal. I remember when friendship with China and Russia was normal. For example, talk about big geopolitical changes in normalcy. I think the biggest change from a business perspective is going to be consumer is going to be constrained. The consumer economy is going to be seriously constrained. And for the industrial economy, it's going to be supply chain. People are no longer going to rely on single suppliers. They're going to have they have to have a diverse supply. They have to no longer have just-in-time inventories. There are going to be major changes in the way, if you're in a boardroom, you're going to be telling your CEO, okay, how long can you last if we get shut down again? If China gets shut down, what are we going to do? Well, that is going to change. Those are fundamental changes in the way we think. I think travel is going to be severely constricted. Last year, there were 1.5 billion people who took airplanes. I don't think you're going to see even 1 billion people take airplanes this year. It'll be far less, maybe 500 million. Very, very dramatic decrease. So that's going to change the way we live. I think there's going to be a big change from urban concentration. People are going to want to leave cities. Mm-hmm. Everybody's been in the last 30 years, again, in my lifetime, I've seen the flight to the suburbs. I've seen the reconcentration and reconstitution of the central city. And now I think we may see the transformation again.
Do you have time for one more question?
Sure.
Because you're one of the very few scientists who actually went to China, and not just China, but Wuhan, because you chaired the US-China Health Summit in February. So you were able to get in...
February, God, no, I was there in November. February, you couldn't even get into the country. You could get in and out of Wuhan.
So what is
I was in touch with people. I saw them all the time in Wuhan.
So what do you think of the conspiracy theories? And do you think COVID-19 is zoonotic or engineered? And do you think it could have escaped a Wuhan lab?
I think the conspiracy theory is a scapegoat by conspiracy theorists that want to stay in power.
That makes total sense.
There is a conspiracy, but it isn't the one they're talking about. It's a conspiracy to blame anybody but me.
Mm-hmm. Well,
as
Bill,
far as I can see, and I've looked at the data in great detail, you'll never get a scientist to say something's impossible. All the best you can get to say is that it's very improbable. Okay, scientists can't know enough to know that the world has odd ways of working. The natural world and the human world. So I would only say that it's highly improbable. And then the question is, does it make any difference?
Right.
We have to be careful anyway.
When you were there in November, were there already whispers about an epidemic? I mean, generally, I know people in China have been worried about a pandemic in general, but did you have a sense that first cases, that they were becoming aware of first cases coming up?
No, I was there in early November, the first week of November. And it's a wonderful city. Wuhan's a beautiful city. It's a garden city. It kind of reminds me of Berlin, but about 10 times as big. Beautiful parks and mountains everywhere, lakes. huge lakes. You know how wonderful Berlin is as a city. It's a really unusual European city. Well, Wuhan's just like that, only bigger. And it's one of the top university towns. It's got a huge high-tech community. It's a very civilized city. It's a tragedy that happened there. But the experience of being in Wuhan, there was no hint of that. People were very, very happy there. So that was my experience in Wuhan. Whether it was there or not, it might have been there. There is some, we have intelligence services that look at open source. And there are some indications that people were worried about a respiratory disease as far back as, let's say, October. There are little spikes in online searches. But that could be just the flu, or it could be any sort of fall. So there wasn't anything that by October or November that people saw, but they saw a lot of activity in December. So we knew, our intelligence community knew through open source, which they monitor for all sorts of things, we knew that there was something weird going on in China. And by December, we have to remember, Chinese reported that they had a new infection with the coronavirus to the World Health Organization on December 31st. So they let us know within 2 weeks. So all this nonsense, how long did the U.S. sit on its hands? We had huge amounts of information that something terrible was happening. 3 months. Well, the Chinese let us know in 2 weeks. Yeah, maybe in that 2 weeks, there were issues. Okay? But after 2 weeks, compared to our 3 months of sitting on the hand, is a huge difference.
Well, I couldn't agree more, and I wish we had more time. As far as I'm concerned, this interview could last forever, and I'm sure the listeners do agree, and I may just as well call on you in the future again. But for the time being, thank you so much, Bill, for this interview and your time. I know you're in especially high demand right now. I wish you all the best for your research, and I look forward to connecting soon.
Good luck to you, Sandra, and safe return to New York when it's possible. Take care.
Thank you, Bill. Bye-bye.
Thank you.